and then share my screen with you. Okay, has that worked? Can you see that?
Yep, yeah, I can see it.
Excellent. Yeah. Okay. I won't mute mute your microphones just now because everything seems pretty quiet. But if you get any trucks going past, I might do that. And this way, obviously, if you think of any questions you want to ask as I'm going along, then you're welcome to do so rather than waiting to the end. So, as I said in my email, and as we have put in our communications, this presentation is about my aged care, and it's designed to give a bit of an overview on how my aged care might support you, and recognise that it's a complex system, and it's something that people don't usually worry about until they really need it, and that's the time we might not be in the best space to understand something that is as complex as the My Aged Care system is. So I hope by the end of today it seems a little bit simpler for you. But obviously we're here to answer any questions either today or as you experience them in the future. So I know that you all know me, but for the benefit of anyone that watches this recording later, and for the person who I can't identify, I'm Stacey. I manage service delivery at MND Queensland, and oh, we've just got one more person coming in.
Oh, excuse me, Stacey.
Yep.
We're just having a little trouble with the volume. I'm not sure if anyone else is hearing real well.
Is anyone else having trouble with the volume?
Yeah, it's sort of drifting.
Is that
just the level?
Better?
Just the level, yeah.
Has that made it better?
Yep, for me it is. It seems all right.
Okay, great. Okay, well, I'll keep going then. So as I was saying, yeah, I'm Stacey. I manage services at MN Queensland, and those services are information on motor neurone disease to people impacted by it and health professionals that are supporting people impacted by it. We provide advice directly to people with MND and their family members. We also do an equipment hire service. We provide supports coordination for NDIS funded clients and also occupational therapy. But like I said, today we'll focus really on people that are aged over 65 who have to get their funding through the My Aged Care system. So the My Aged Care funds people in 3 different ways. They offer help at home through either a Commonwealth Home Support Programme or a home care package. They also fund short-term care and contribute to aged care homes in the form of residential care as well. Whilst I will touch on short-term care and aged care homes as part of this presentation, most of it will be focused around that help at home, really because that's where most of our clients engage with the My Aged Care system. That's where most benefit will come in, or most people will be affected. So one of the first things we encourage people to do when they find out that they have motor neurone disease is register with My Aged Care. It's not a simple process to get funding through My Aged Care, so it's important that we do it as early as possible, so that the supports are in place ideally before we need them, or we have the best chance of the supports being in place before they're needed. And you can register with My Aged Care in a number of ways. So you can get a referral from a medical professional, so your GP or a nurse that you might be seeing. You can get, if you're seeing an OT or a physio, they can do the registration for you. We could do it if you wanted us to, or the simplest way is to do a self-referral. So you can just go on their website, myagedcare.gov.au, and sign up there, or just give them a call. So phoning the My Aged Care number, 1800 200 422, is the simplest way to do it, because they'll get it done there and then whilst you're on the phone. You know it's done because you've done it yourself. And if you want anyone else to be able to talk on your behalf, you can do that at the same time as well. So it just is the quickest way to go through that process. And once you are registered with them, then they will generally determine what kind of supports you're looking for in that initial phone call. A Commonwealth Home Support Programme, or what's known as CHSP or CHISP services, is a really basic level of support that most people access immediately when they do register with My Aged Care. To access that support, you need to have what's called a RAS assessment, so an in-home assessment conducted by the Regional Assessment Service. The good thing about this assessment is that it tends to be really quick from the point of registering with My Aged Care. Usually they'll contact you within about 48 hours to schedule a time that's convenient for you, for them to come to your home and go through that basic assessment. So they're not clinicians, they're people that really are following the script and just working through a bit of a questionnaire with you to identify what your needs are. And it usually only takes about an hour to do that. But through that process, they'll determine what services they can offer you. And there is quite a range of services that the CHISP package covers. So I won't go through all of them, but just to give you an idea, you can get allocation of funding for things like personal care, so someone to come into your home and help you with a shower or getting dressed or something like that.
Stacey,
yep.
Sorry, volume is still a problem.
Pardon? Volume? Okay. I think it might be because I'm sitting back in my chair.
That's better.
Right. Okay.
Yes.
Did you miss something? Do you want me to go back or keep going?
Keep going.
Okay. All right. Thanks, Andrew. So as I was saying, the kind of services that they offer are personal care, nursing. They'll do meal preparation or food delivery, and so basically somebody to come into your home and prepare a number of meals for you in advance, or a service like Meals on Wheels, that kind of thing. You can also access allied health services, so occupational therapy, physio, podiatry, dietitian, that kind of thing. Or domestic support, so essentially a cleaner. You can get someone to come and do yard maintenance or home maintenance. This is like minor home maintenance, so changing light bulbs, checking your smoke alarms work. Maybe fix up small things around the home. They will do minor home modifications as well, so if you needed things like grab rails in the shower, you can access that through the CHISP program. They do equipment hire, or they supposedly do equipment hire, and I'll talk a little bit more on why that's a supposedly in a second. They'll do referrals for respite, both in-home or residential. They can provide transport services, either in the form of like a bus that will come pick people up in the morning and take them to a particular location and pick them back up in the evening, or they can do a different type of transport, which is actually a service picking somebody up and transporting them to an appointment, waiting with them and bringing them home. It's a bit more personalised. They'll also do social support, so community access, that kind of thing. One of the things that we always recommend is that whilst that range of services seems quite broad, we suggest that people get referrals for everything they're willing to get referrals for. Even if you think you'll never need them, just because it's easier to get them at the first assessment than to try to tack on additional supports later on. So it doesn't matter if you never use them, but just having the referrals there for your use if you need them is helpful. The good thing about the Commonwealth Home Support Package, or the best thing about it, is it's not means tested. So it really doesn't matter what your income is. You do have to pay a small contribution for each service. So it's usually about $5 or $10 each time someone comes to support you. And those services are all offered by service providers. So it's not My Aged Care, doesn't deliver it directly. They fund service providers in the area to actually deliver the services. which means you could end up with a number of different service providers assisting you. So you can have one service provider doing your personal care, one doing your meal preparation, someone else doing your domestic assistance. So you can have lots of different people involved in your support. And the RAS assessor, whilst they're with you, can either make a referral directly to a service, so they can see which services are available for you, or they can give you what's called a referral code for you to find a service provider. And there's pros and cons of doing each. So the way that the SHIS package works is that each service provider is allocated a set amount of funding for the financial period. And when that funding's run out, it runs out. So if people are referred to their service, eventually they get to a point where they won't accept any new referrals. So letting the RAS assessor do the referrals for you means that you'll know which services are accepting referrals rather than blindly calling around all the different service providers in the area. However, the cons of doing it that way are that you're waiting for the service providers to contact you, so that you don't know whether that's going to be 2-3 days, a week, or longer. And also, you're more likely to end up with a range of service providers providing the support. And if they run out of money, then you can't get that service. So, for example, on the Gold Coast, I don't know anyone that can access yard maintenance because the funding, all of the service providers have run out of funding for that. And I think it's the same with domestic assistance as well, or at least it was. However, if you phone a service provider yourself wanting personal care, they will sometimes still have a little bit of money left in the bucket for domestic assistance. So knowing that you're going to become a client of theirs might mean that they can squeeze that service in as well. So the RAS assessor will tell you no one's taking referrals for domestic assistance in some instances, but you might just be able to find a service provider if you take it on yourself. Okay, so that's the CHISP service. The next one, the home care packages. These are individualised packages of funding that will be allocated to you to use as you require them across a range of supports. And in order to access a home care package, you need to have a bit more of an in-depth assessment done by what's called the ACAT team, the Aged Care Assessment Team. And your assessor in this instance will be a clinician. So you'll get a nurse or an OT or someone like that come out and do the assessment, which means that they have a bit more of an understanding about what your needs might be and are more likely to know what the neuro disease is and how it might affect you into the future. But whilst that assessment will be more comprehensive and will take longer to go through, they are supposed to be looking at current need. So they will be asking you things like, what of your daily living tasks do you find difficult right now? And it also takes some time to get an ACAT assessment in most instances. So waiting 8 weeks is fairly common. Waiting longer than 8 weeks is not unheard of. I've known people wait 12, 13, 14 weeks just to get the assessment done. But once it is done, they will allocate, so there's 4 levels to the home care packages, and they'll determine which one is suitable for you based on their assessment of your need. And each one of those has a set amount of funding allocated to it. So the level 1, they class that as somebody who only has basic care needs, and they allocate $9,000 for the year to somebody on a level 1 package. That will jump up to $15,000 for somebody with low care needs. It's been allocated a level 2 package. And then the level 3 and 4 is a big jump again. So intermediate care is just over $34,000, and high care at level 4 package is over $52,000. So there is quite a gap between those low level 1 and 2 packages and the higher level 3 and 4 packages. That money is allocated to you each year. So each year you'll get that amount again, but it actually goes to a service provider. So it doesn't go straight to your bank account, it'll go to a service provider, and they're giving it monthly to pay for your care needs. The way that home care packages are notoriously difficult to actually access because of the wait times for them. So even though you've already waited upwards of 8 weeks for the assessment. You then have to wait again once the package has been allocated to you. Essentially, there is a finite number of packages out there, and you're waiting for one to become available based on, unfortunately, someone passing away. It's possible that someone might decide they don't need their package anymore, but it's usually you're really waiting for someone to pass away and their package to become available. How close you are to the top of the list will obviously determine how long you wait, and you will be assessed as your level of priority will be assessed by the ACAP assessor. They'll tell you you're either a medium or high priority. Medium is a bit misleading because it suggests that you're kind of middle of the range in terms of need, but there isn't a low priority, or certainly I've never come across a low priority. So medium is essentially a low priority. So we really need to make sure that you get assessed as a high priority, otherwise the wait is ridiculous. Level 1, people allocated level 1 will wait at least 3 to 6 months if they're medium priority before they can access anything. Level 2 is 12 months, and realistically level 4 is upwards of 8 months for a medium, 18 months, sorry, for a medium priority. So it's a very, very long wait. And these packages are means tested. So if you receive a full government pension, you're fine, you don't have to worry about anything else, you'll get the full allocation of funding. But if you're a part pensioner or a self-funded retiree, then you will, or you potentially will have to pay an income tested care fee. And that will be determined, the amount of that will be determined by Services Australia. They're essentially Centrelink, so they take a long time to go through that assessment of your income. So we would recommend that if you are a part pensioner, or you receive a part pension, or you're a self-funded retiree, you get straight onto Services Australia as soon as you know that you're going to get an ACAT assessment, and ask them to provide you with a pre-commencement letter. They'll need to go through lots of details about your finances to determine what your income tested care fee will be. And basically, what will happen is, out of the package that you've been allocated, so you've been allocated a level 4 package, then you will have access to 52,000, but you will be paying some of that. So if you're assessed as needing to make a contribution that's the equivalent of, say, $6,000 a year, then the government will provide 46,000 and you'll pay the other 6,000 to get it to the total package. You pay that to the service provider. If you don't want to call Services Australia, you can go on the website. There is a form on the My Aged Care website that you can fill in and send off to Services Australia as well. And there's also a home care fee estimator on the website. So whilst you're waiting for them to tell you what your income tested fee is, you can kind of figure out yourself what it's likely to be. All right, so the income tested fee is obviously based on how much income you have coming in each year. I'm just going to mute people because we're all going. I'm just muting myself there. I will keep going and hope that whatever that background noise is goes away. All right, so the income tested fee is based on your income, including your pension. So the lower level contributions will be up to $15.43 per day that you have to contribute. Like I said, you pay this directly to your service provider, so that's about $108 a week, and that's if you're single earning over $27,840 or a couple earning over $21,606, and like I said, that includes your pension as well. That daily contribution increases to between $15.43 and $30.86 per day, which at the top end is about $216 a week. It increases to that if you're earning over $53,731 as a single, or $41,121 as a couple. Okay, so when you have been allocated a home care package, so you'll be allocated it and then you'll get a letter in the mail saying one has become available for you. And at that point, you'll need to choose a service provider. We strongly encourage that in order to choose a service provider, you have to think about services that are in the area, and maybe talk to other people that receive services through My Aged Care and what they think of their service provider, and then arrange to meet with 2 or preferably 3 of those service providers so you can get a feel for the kind of services that they offer and whether that's a good choice for you. Some of the things that you need to consider are the fees that come with that the service provider charges. So My Aged Care allows service providers to charge a basic daily fee. That's a maximum of, I think it's $10.64, but the service provider doesn't have to charge it. So it's their choice about whether or not they make you pay that basic daily fee. They will also all charge what's called a care management and package management fees. Some of them might combine the care management and package management fee in one go to make it look like they only charge one fee. But you need to have a look at the total cost that they're going to charge you for managing that package. Because again, that comes directly out of the annual amount allocated to you. If a care provider does charge the basic daily fee, that shouldn't be enough in itself to just rule them out, because something else that you need to consider is their hourly rates for services. So on the website, the My Aged Care website, you can have a look at a comparison tool they've got there and select up to 3 service providers to compare side by side. And you'll see their charges for things like personal care, domestic services, nursing, and see how their hourly rates compare with each other. And obviously, if one of them charges $10 an hour more for personal care than the other, then there might be instances where paying a basic daily fee to the one that charges less means you're better off overall. So it's just, you need to look at all the different factors. Another thing that people don't always realise but is really crucial is whether they have a minimum service delivery time. So some service providers would be happy to come out and just support you for half an hour if that's all your shower takes, for example. Whereas others have a minimum visit of 2 hours. And obviously if you only actually need help for 20 minutes, half an hour, then what are you going to get them to do for the other hour and a half, because it is coming directly out of your funding. So you have to think about whether that's going to be relevant to you. They'll also potentially charge travel for their staff to get to your home. Some of them will have organisational policies that might mean that you need 2 people to come and help you. So if you need to be transferred using a hoist, for example, some service providers have a 2-person hoist policy. So that's something worth asking if that's going to be relevant to you. And most of us get up at a set time each day, and some service providers will commit to being at your home, say at 6:30 when you get up in the morning, and others will say that they'll be there between 7 and 10 a.m. So another question that's worth asking. The other and main reason why I always suggest that people meet with the service providers is that they will send out the person that would coordinate your service in most instances. So you'll be meeting the person that you'll have the most contact with when you've got services in place. And it's important that you feel that they are a good fit, there's shared values, and that you feel like you'd be comfortable to give them a call if something's going wrong, or you just wanted to talk about how you need to change it, that kind of thing. So at least being able to meet them face to face gives you that feel for whether it's a good fit or not. It's also worth checking how many staff they have in your area, how well established they are in your area. So if they have lots and lots of clients in that area, the chances are they'll have lots and lots of staff. So if your regular staff are unavailable, then they'll have other people that they can ask to come and support you. Whereas if you're the only client in the area, then the chances are they won't have anyone that can replace anyone that calls in sick. I would also ask that what training they do for their staff. You need to feel confident that the person coming to support you has the relevant skills to do that. And if you game, you can ask about retention rates as well. So the aged care and disability sectors are notorious for having really poor retention rates. And so there are some service providers who've been able to really work with their staff to retain them, whereas others do a bit of a churn and burn, and they're constantly recruiting new staff, which means that you would regularly have new and different people coming into your home. Another thing to consider is whether or how they feel about brokering services to other organisations. You have a right to use your funding to pay for services from other organisations, so they can't just say no, but the service providers will have their own health team, so, or a service that they usually use for that. So if you mention that you want an occupational therapist, they would usually have somebody that they would send to do that, or a speech pathologist, that kind of thing. Whereas you can't be sure that those people have MND experience. So you might already have a pre-existing relationship with somebody that you'd want to use in that instance. So it's worth asking what the process would be to broker services. Some of the providers are absolutely fine with that. Others, you can see that they're kind of reluctant to do it, and they might charge for it as well. Usually when they don't already have a pre-existing relationship with the service to use, they'll charge you to set up a brokerage agreement. So that really is home care packages covered. Like I said, I'll talk briefly about short-term care. So short-term care is something that My Aged Care put in place to assist when somebody's circumstances change. And they do it in a number of ways. So they have what's called a short-term restorative care program. And that is a time limited, so 8 weeks period of support for people that's designed to help with rehabilitation. So really it's around somebody who might have had an accident at home. They might need to have some support for a fixed period of time to get back to where they were beforehand. Short-term restorative care funding is managed again by a local provider. So not all of the My Aged Care providers will do short-term restorative care. There's a select number of people that will do it. And they'll take your funding for that 8 week period, and they'll coordinate supports for you during that time. And those funds can be used for things like home modifications, ones that are a bit bigger than the CHISP services will cover. They can get some equipment organised for you, whether that's purchasing it or hiring it. And obviously if you're going to get equipment, you'd need an occupational therapist to come out and assess what equipment you needed and source and trial that with you. And they can also do additional in-home care during that time as well. So once the funding, like I said, it's a limited amount of funding, so it isn't just as much as you need, they need to budget around that. You can access the STRC whilst you're getting CHISP services as well, so it can top those up from a period of time. And the transition care program is really similar to STRC, but is designed for people who have been in hospital. So that would be put in place for you for discharge from hospital. And you can either use that at home to get set up after a discharge from hospital, or if you needed to go to an aged care facility for some interim care, it can be used there as well. And then respite care is really designed to give your regular carer a break, or your informal carer a break. That can be due to an emergency. So if your informal carer got sick, or another family emergency meant they needed to go away for a period of time, then you can get some emergency respite by calling Carers Gateway. We suggest that people register with Carers Gateway if they're providing care anyway. So anyone who's in informal care can register, and that way that just speeds up the process if you need to access their funding. You can also get community respite as well. So through the CHISP funding, they'll do respite, and that can be, you can get funding for respite in a day centre, so like an aged care facility, but on a day basis. So you go in the morning, get some support through the day, and then go home in the evening. You can also get a community respite, what's called cottage respite, or community respite in a cottage environment. And that's if you need something a little bit more, like for a couple of days, so 2 to 3 days at a time. including the overnight care, and that can take place either in the community or with a host family. I've not personally come across the host families, but in doing the research for this presentation, I discovered that as an option. And then flexible respite is really what the CHISP services offer. So if you have a carer, then you can have someone come in for couple of hours in the day if that person needs to go out and do some shopping and just have some time to themselves. And then residential respite is really for higher needs. So if you needed to go into an aged care facility for a short period, so it's a few days to a few weeks, then you get that round-the-clock care if needed. And the My Aged Care system will subsidise 63 days of residential care each financial year. But if you needed more than that, then the ACAT assessor themselves can increase that by a further 21 days. And then the last one that we touched on was aged care homes. So I know that making a decision to go into full-time residential or permanent residential care can be a really difficult one for people and isn't usually a welcome choice. But there are instances where people's care needs are higher than a home care package can possibly cover. So we talked about that higher level. The top level of home care packages is $52,000 a year. That doesn't stretch far for people with those higher care needs. And particularly if those people with those higher needs don't have any informal care, then an aged care home could be a suitable option. And obviously if you're in an aged care home, then you get the access to the care you need, you get access to nursing, you get your meals sorted, and then you can also access allied health through there as well. You'd obviously be familiar with the aged care homes in your area. You would be in a position to choose which home you were most comfortable with, but you need to bear in mind that people will, or many of them will have a waiting list. So with most things with MND, we encourage people to plan ahead so that you don't find that the need exists before the solution is in place, because obviously that can result in people not getting access to the care that they need, or in being at higher risk of injuries or falls, that kind of thing. So choosing a home, an aged care facility would, I imagine, be a pretty difficult decision to make, but we do know that you can access placement consultant services, and they are, there's a fee for their service, but they'll help you choose a home, and they can also help with some of the financial planning that goes around that as well. When choosing a facility, it is important to note that the government does not subsidise every single home. They do subsidise most of them, but there are some private aged care facilities that don't get any government subsidies. So if you want to reduce the amount that you pay, then it's important to choose one that is subsidised by the government. And again, you need to make a contribution to the cost of that care, which is the amount of which is based on an income assessment. So that's My Aged Care in a nutshell. What I want to talk to you about now is how we can help you if you are in this situation where you need some support around My Aged Care. So I said before, we could help with registration if you wanted us to. Our main area of help is really by supporting you at those RAS or ACAT assessments. We can make sure that the assessors understand motor neuron disease and how it might impact you. And we find that in the ones that I've attended, people tend to play down their needs, whereas we'll take the opposite approach, and we are quite comfortable in playing up what your needs might be, because again, we're keen to see support that exceeds need, not the other way around. So if we need to exaggerate a little bit, then we're willing to do so. What we also are very conscious of and try really hard with the assessors to achieve is to move them away from that mindset of assessing you on your current need. Because the progression of MND is so unpredictable, if you get assessed on your current need, given the likelihood of change, then you're always going to be behind your need in terms of the amount of support that you get. So we try really hard to convince them to take into account the fact that MND is progressive, and think about what you might need in the future. And I find that usually they are willing to do that. Maybe a little bit of initial resistance, but they usually come on board in terms of the importance of that. And we would give advice that regardless of the level of need you have right now, the process we would encourage you to take is to register for a RAS assessment initially, because of the speed in which you can get some services. And then at that RAS assessment, which should happen only a few days after registration, that's when we ask for the ACAT assessment. And like I said, we get all the referrals that we can in the initial RAS assessment, so that support will see you through until the ACAT assessment takes place, or at least it will do its best to see you through. If you don't get all of the referrals during that initial assessment, and then you're on the wait list for an ACAT assessment, going back to ask for an additional referral for CHISP services will take you out of the ACAT queue and put you back to the beginning. So that's why I said before, we need to make sure we get everything that you might need, not just what you need now. We'll also help you to set up services. So we'll help you do some research about which service providers are in your area, and phone them and make sure that they can respond in a timely manner to your need. We'll also help you determine whether you should accept a home care package. So I said before, you'll get a letter to say that you now have one, it's available to you, and you actually have to accept that home care package. But there are some times when accepting the home care package might not be in your best interest. So an example of that would be if you've had your income tested fee and you need to make a considerable contribution, and you've been told that you've got a level 2 package waiting for you. Going from CHISP services, if you're getting lots of support, to a level 2 package, they tend to be quite similar in terms of the amount of support you can actually access in that way. And so you could find yourself going from or moving into similar level of supports just with one provider, but paying more for that. So we'll help you determine whether that's in your best interest. We'll also help you with identifying the My Aged Care providers, shortlisting them for meetings and setting up those interviews with you. And if you want us to, we'll attend those interviews with you as well. So we can make sure that we cover off on all those different areas that I said before that's important to explore with them. During those meetings, what will also happen is you go through a bit of a budgeting discussion. So you talk about how you can maximise the supports that you get from the funding that's been allocated to you, so we can help with that conversation as well. And one of the things that we also explore is usually when somebody's on an aged care or it qualifies for My Aged Care, then often their partner would also be of a similar age to qualify for it. So if you're maximising your funding, if your need is higher than the funding is likely to support, then we can explore areas that you might be able to top that up. So, for example, you could use your home care package purely on personal care, and then get a RAS assessment for your partner, if you have one, so that they can use that RAS assessment to pay for things like the yard maintenance and the domestic assistance. They can't get personal care because the RAS assessment will be for CHISP services for them personally. So obviously there's pointless them getting personal care if they don't need it, because that person couldn't assist you. But at least if you can take away some of that stuff that's more general household, then you can focus your funding where you really need it. So I think that brings me to the end of everything that I wanted to talk about. So were there any questions from any of you?
No.
No questions at all? No? Okay, all right. Well, I will wrap up at that point then. So if you do think of any questions that I haven't covered, then obviously you all have my contact details, so feel free to email me or call us at the office, and I'll be happy to answer anything that you think of after the event. just try and take my screen back. So I will. Nice to see you. Bye.